I don't know. I think it messed up my whole movie-going experience, you know? I don't want to go back to the movies just because something like this might happen.
You know what? Hang on the line here, because maybe I have some help for you. Erik Fisher is a psychologist, and earlier he spoke with us just in general about the fear people are going to have now. Erik, do you have some encouraging words? Oh, are you here in the studio? Erik, hi. Do you have some encouraging words for Selena Jordan? She was in theater number 8. The shooter was in theater number 9, and she's been describing what she saw and expresses some fear when this all sinks in here.
Absolutely. I think the thing that it's most important to do is to talk about what happened. Make sure that you talk about the experience and work it through. A lot of times when things like this happen, people just want to take those feelings and bury them. You want to forget about it and move on. But that's not a good thing, because those events can really kind of stay stuck inside. So the biggest thing that I do in my role as a psychologist is really help people to talk out the traumas and tragedies and events that happen in life, to help them understand them emotionally and cognitively. You said some really important things in terms of how it took a while for you to process the experience. And the thing to realize is being able to take yourself out of a movie that's fantasy and then all of a sudden make something reality when reality is mirroring fantasy is really difficult. And sometimes when people are in those experiences, it makes it feel that much more surreal even afterwards. It may feel like a dream state to you for a while, but it's important not to just bury it. So make sure you're talking about with some people close to you. Get a little therapy, I would say, to talk it through with a professional, and make sure that if you're having nightmares, to make sure that you're talking about all that too.
Okay.
Selena,
I wish you luck through this.
Go ahead.
I was going to say, because he brought his nightmares, I definitely woke up like 3 times out of my sleep. And I only told you I was asleep for like an hour max.
It will take time. It will take time to process this, and that's normal, because our brain processes information over time, especially things that we can't handle in the moment. We deal with them over time, and our brain takes them in bits and pieces. And that's why, to me, I believe that's why we have dreams the way we have them, is we can't have literal dreams. They're too much emotionally to handle. So you might have dreams that are metaphorically similar to what's going on. So just understand that those dreams are your mind's way of working things through. Write them down, work them through, talk about them, and get some help for that.
What do you think about that, Selena?
I'll definitely take that advice.
You know,
I'm taking anything.
Go ahead.
I was just saying, I'll take anything anybody says that would help me.
Yeah, and it's only you're only a few hours into this, but Erik Fisher, she has been talking to the media, so she's been telling her story all night. Isn't that helpful for her, or you're talking about something different?
It is helpful, you know, to talk about it and get it out and replay it. But also, again, having somebody who's able to really look at the emotions. What we have to look at is how our mind integrates emotion with logic. And when we take emotion and we don't understand the true meaning of that emotion, and we try to make sense of it from a place of not knowing, it can really kind of get it twisted in ways. So we want to have the ability to look at something and understand the value of that emotion or that experience, you know, and turn something that was tragedy into triumph. You know, that we were able to work through this extremely difficult situation and make it through it okay, that it hasn't affected us the rest of our lives. I would hate to see people, or wouldn't want to see people, come through this experience years later and say, this destroyed my life. It is very difficult and it is very traumatic. However, what we do with it as an individual, we can turn this into something to helping other people who have been through similar things, or we can really turtle in and have it really affect us the rest of our lives.
You know what, is it Dr. Erik Fisher, correct?
Yeah.
Yes. Dr. Fisher, I'm going to put you in a tough spot, and that is, I don't know Selena's position. She may not be able to afford counseling, so maybe you can help us ask, after the break, help us to know what questions to ask ourselves that will help ourselves through it. If we can't, not everyone can afford such counseling. We'll be right back after this. We just learned the name of the suspect here, and his name is James Holmes. Okay, James Holmes, H-O-L-M-E-S, folks, and he is 24 years old. Do we know where he's from yet? We don't know where he is from. We just have his name that has just been confirmed. And so people like Salinas and everyone else who was a part of this in the theater, now Erik Fisher, who's a psychologist, they're hearing his name. They're putting an aid to him. And you had said there's going to be a lot of people who are going to need professional therapy, but maybe Salinas and everybody else might not be in a position to afford that. Are there questions that they can ask themselves and maybe write down the answers to that will help them process through this?
Well, you know, there actually are some good books out there that can help people work through therapy. There are workbooks, you know, work through traumas and things. But the thing to understand is that everybody deals with traumas differently. Sometimes what happens when we have traumas in our life, they remind us of previous traumas we went through. And that's when we might have what we would call a post-traumatic reaction. Even after something like this, you might have more of an immediate on-site post-traumatic reaction. But the first thing is that when we experience trauma, like I said, we go into almost a dissociated state to help us deal with it. Now, as Selena...
So is that why she's saying, I was just in shock. I was just in shock. I still can't believe it.
Exactly, because we can't comprehend when something like that happens that's so beyond our reality, we can't comprehend it. It's some part of us, in some ways, almost shuts down to help us deal with it, to get out of that situation, to survive. Then beyond that, then we start to process it once we're out of that trauma. So that's where I would expect Selena to go through some situations. As she gets further away from this time, gets home, things get quiet, then the emotional start coming up, and then she might re-experience it. Even as you showed that young man, that little, you know, it looked like he was 12, 13-year-old young man on the air, you could see when he was talking about it, he was out of breath almost. And to me, it looked like he was almost reliving it, and when he relived it, he started to lose his breath. So people, that's why talking about it is important, to make sure you're working it through. But find, again, if you can find even a minister, a pastor, a counselor, a school counselor, a friend who's a professional, but be careful not just to talk to anybody. Make sure you're talking to somebody who can help you work it through and understand it. There are a lot of people out there with advice. Yeah. It doesn't always mean it's good advice.
Selena, when you were talking to me, are you out of breath? Have you had a chance to kind of get emotional about this?
Every time I talk about it, it's like, it's harder for me to breathe, and my tears starts to well up.
Yeah. I can only imagine what you and some of the family members are going through, too. I'm so grateful that you're okay, Selena, and I hope just talking with us helped a little bit. We're going to take a break and be back with more of Witnesses right after this.